Hi, it's Professor Sarah Sears. We're going to talk about our cardiac assessment today for nursing health assessment. So what I'm going to show you, I'm going to use little stickers and I'm going to landmark on me where you would put your stethoscope for the different valves. My favorite acronym to remember the heart valves is all people eat taco meat, but you could do all people enjoy them all people enjoy Times Magazine, whatever resonates with you, go for that. But one of those memory tricks or mnemonics is really helpful. So we actually start listening for the heart on the right side of the chest for the aortic valve. So you do need to count rib spaces to accurately place your stethoscope. This is important, especially if you're going into cardiology and you really have to know what valves are where. And we need to know how to count rib spaces too when we're doing an EKG to make sure the leads are in the correct place. So what we do to start that is if you find your collarbone, okay, so collarbone right here, you're going to count the rib spaces. So I can feel the little space here. So there's one, and I can feel down one more. There's the second space. So all of my ribs are going to be about that far apart. So the first one here, we have to listen to the right sternal border, second intercostal space. This is my aortic valve. So in that all people eat taco meat mnemonic. What you can do here, you can slide directly across to this valve, and I can mark the second one. This is the second intercostal space, left sternal border pulmonic valve. Then I've got to go down, so feel your rib spaces here. So here's my third space, okay, on both sides. This is going to be all people eat taco meat. So this one is my third intercostal space, left sternal border. This is Erb's point. Now we've got to go down one more. Okay, so we know it's about that far apart, but I can feel my rib space here. Okay, this is my 2, 3, 4th intercostal space, left sternal border, tricuspid valve. And then our last one is going to be the mitral valve. Okay, so mitral valve is the 5th intercostal space and it's mid-clavicular line. So usually for females, you kind of have to push the breast tissue up and out of the way, but this one would be about right here. Okay, and that's the same site as your apical impulse. So we can listen there for a full minute if we need to count a heart rate. Again, this is actually a little higher because you've got to displace the breast tissue so you can listen in the correct place. So those are the spaces on me. We can look at our mannequin here and do them on him as well. So when we look at him and we do our assessment, okay, you can kind of see his collarbones here. It's actually a little easier on a real person, but I know I'm going down about 2 rib spaces. So this would be my first one. So again, I'm listening to the sternal border right next to it, and that's probably not quite close enough here. Okay, that's my aortic valve. I slide across. I have my pulmonic valve. We'll go down 1 rib space. All people eat taco meat, Erbs. Down 1 more. This is my tricuspid. And then I can go across to mid-clavicular line, and this is my 5th intercostal space. So kind of like right near nipple line or just under. So this can be helpful for you for landmarking so you can really see where the different spots are here. Again, when I'm listening with my stethoscope, you know, I'm placing it and listening. You want to avoid the tube rattling around. It's going to produce a lot of artifact and make it hard to hear. So again, we've got to listen. You can tell your patient to breathe normally and listen in each spot to see if we hear any murmurs, which would sound like a loud whooshing noise. And what you have to do for your checkoff as well, this is the diaphragm, the larger side. You have to flip it and listen with this side as well. So same thing, I'm just lightly placing this on the chest, listening in each of the locations. When you go through, you have to tell me the name and the location of each. So this is the aortic valve, second intercostal space, right sternal border, etc., all the way down the first time you go through. But the second time you go through, you can just place the stethoscope We are assessing your technique as well as if you're telling me the right location for these. Okay, thank you.